How are we doing today? My name is Dr. Money. I'm quite busy, so let's get this started. Who do we have in here today?
This is Agnes.
Okay, all right. And what's your date of birth?
12/11/2023.
All right, sounds right. What brings you guys in today?
We're both just kind of a little worried about that there might be something wrong. She's just kind of in a lull, I suppose. She's been acting kind of different out of the ordinary from our other children. So.
All right. Anything specific signs and symptoms you noticed?
For me, I've noticed she hasn't really been gaining any weight. She eats quite a bit, but just is kind of still about around the same weight that she was a couple months ago. She also coughs a lot. Change the diapers, is there anything you've noticed?
Yeah, I don't know why I have to change the diapers. She just doesn't like it, but I don't know, there's been a lot of fat in her poo. It's gross. It's pretty freaking gross, and I'm just kind of like, what the heck?
I understand.
But
Okay.
that's all I've seen.
All right. Any other symptoms that you've noticed?
A lot of coughing when we're trying to sleep.
Coughing.
It's hard to sleep.
Is it a very productive cough?
Yeah, there's sometimes there's something that will, spit, shoot out.
Interesting. And do you guys have any family history of issues like cystic fibrosis, perhaps?
Yeah, on my side I do.
Your
I
side?
think
Any?
Yeah, my grandpa Robert Gucci II actually
Sure.
has cystic fibrosis.
Okay, all right. Well, that's interesting. So there is a possibility that we're dealing with cystic fibrosis here. So what I'm going to do is order a sweat test really quick because that is the gold standard for diagnosis, and we'll meet back once we have the results.
According to the Cystic Fibrosis Foundation website, the citation can be found at the end of this presentation. The sweat test, otherwise known as the Orion Chloride Electrode or Gibson-Cook titration, measures the amount of chloride in the sweat. There are no needles involved in this test. In the first part of the test, a colorless, odorless chemical known as pilocarpine, as well as electrical stimulation, is applied to a small area of the arm or leg to encourage the sweat glands to produce sweat. The sweat is then collected on a piece of filter paper or gauze in a plastic coil. The collected sweat is then sent to a hospital laboratory to measure how much chloride is in the sweat. A negative test will have less than 30 milliequivalent of chloride, whereas a positive test is greater than 60 milliequivalents of chloride.
All right, so we've got the results of the test here, and as it turns out, Aggie Waggy is positive for cystic fibrosis. We've got a result of 60 milliequivalents of chloride, which does constitute a positive test, so we're fairly certain that she has cystic fibrosis. Do you have any questions about cystic fibrosis?
I guess since neither of us have cystic fibrosis, I guess I'm not really following how she's able to have it.
Oh, absolutely. Let me explain that for you really quick. So, cystic fibrosis is an autosomal recessive disorder, which means that it can only be expressed in your phenotype, which is your outward appearance and traits, if you have both genes, because if you have a non-cystic fibrosis gene, your body will choose to express that. So, more than likely, both of you are carriers. So you both have one cystic fibrosis gene, one non-cystic fibrosis gene or allele. Now, when you reproduce, there's a 50% chance that either one of these will be passed on to your child. So in one potential outcome, neither of you pass on the cystic fibrosis gene and you create a child who's not even a carrier. More than likely, in half of the cases, you're going to produce a child who is a carrier because they have one cystic fibrosis gene, one non-cystic fibrosis gene. But 25% of the time, you are going to produce a child with both cystic fibrosis genes. And so even though they're recessive, you'll have no choice but to represent the cystic fibrosis phenotype.
And that's Aggie.
And that's Aggie, yes. Now, do you have any other questions about the disorder itself?
I guess what's the next steps here? How are we gonna help her?
So cystic fibrosis is a all-encompassing disorder. What it does is it changes the mucus production on surfaces inside the body, and that can affect multiple systems, and so it's going to take multiple professionals to treat Aggie Waggy throughout her life. Now, in the respiratory system, what it's going to do is produce much thicker, heavier mucus, which is going to be hard for your body to transport out. So that's going to increase your risk of both infections and obstructions, and so it can really reduce pulmonary function. And that's why it's going to be important to work on physical activity and clearance techniques to maintain Aggie Waggy's infection-free status. But cystic fibrosis actually affects many systems besides the pulmonary system, including the digestive system and the pancreas. In the pancreas, what it can do is reduce production of pancreatic enzymes, and what that will do is make it harder for Agnes to absorb nutrients from the food she eats. And that's why we've noticed not as much weight gain as we'd like to see. In the digestive system itself, it will also reduce absorption, and it can lead to tissue damage and obstruction, which is probably why we're getting constipation and fatty poop. The cystic fibrosis can also affect lots of other systems, including the reproductive system. So for females with cystic fibrosis, we do see a slightly reduced fertility, and for males, they're actually 97% infertile. Yes. As far as treatment going forward, there are lots of medications that can be used to treat cystic fibrosis, but the really important thing here is going to be keeping up with interdisciplinary therapy. So I'm going to order physical therapy to evaluate her motor development and keep her active so that we don't run into issues there. I'd also like to order occupational therapy and dietetics to work on the weight gain. Okay. All right. Thank you for coming in today. I'm afraid that's all the time we have. We'll schedule a follow-up. If you have any questions, please ask my PA. All right.
Ball doesn't go high enough.
Hi guys, welcome in. My name is Maddie. I'm going to be your physical therapist. How are you doing?
Good. How about yourself?
Good. You are more than welcome to take a seat. And what are your guys' names?
I'm Erica. This is Agnes.
Nice to meet you.
I'm Robbie.
Nice to meet you. And how are we doing today, like the little one?
Good. I mean, she's 12 months old, and I've just been kind of noticing she's kind of maybe a little bit delayed on some of her milestones compared to what our other children were like when they were younger.
Okay.
She hasn't been really crawling much. She hasn't begun to start walking either. Noticed a lot of coughing and kind of having some, what do they call it? Is it, I think we looked it up, it was like sputum or something.
Sputum?
Yeah.
Like cough production?
Yeah.
Okay.
So yeah.
Nice. Is she crying a lot at home, having these coughing fits at night or all the time?
Kind of just throughout the day.
Okay. Okay. Sounds
Can't sleep. Can't sleep.
okay. Well, we'll try to work on that with her here. So what do you think are your main goals for your child here in physical therapy?
Well, I think just maybe a more, just maybe interacting more with her siblings and us while playing. Maybe sitting up to play.
Okay.
Maybe less coughing.
Okay.
Loud.
Yeah, we can work on that. Okay, yeah, for sure. And who is the primary care provider while at home?
Usually it's me. I'm a stay-at-home mom, and he's usually at work.
Okay, so I'll be teaching both of you the interventions we're going to do with Agnes today, and then you'll be doing them most of the time, but you can all definitely help in the morning at night. Okay, perfect. Okay, so the first thing I want to do with you guys and Agnes is complete this PDMS-2 assessment. It's a motor development assessment, and this is just going to help me find where her impairments are coming from, like not being able to walk or crawl or sit by herself. So we will go ahead and do this first.
The Peabody Developmental Motor Scales 2nd Edition, otherwise known as the PDMS-2, is an assessment used for children ages 0 to 5 years old to estimate an infant's motor ability by providing qualitative and quantitative info about a child's motor development. This is based off of their gross motor and fine motor skills. Gross motor skills include reflexes, stationary, locomotion, and object manipulation. Fine motor skills include grasping and visual motor integration. Once scores from these two areas have been determined, they are then combined to calculate the total motor quotient. These standardized scores and percentiles are used to compare age equivalents when reporting results to parents.
So what I found from the PDMS-2 is kind of consistent with what we thought before. She is having motor development delays in that unsupported sitting, crawling and walking, obviously. And then I also found that she's having trouble grasping objects and like kind of playing with toys and being able to handle them. These are all things we can work on in physical therapy, and then I can send you home with activities to work on them at home. I also noticed that she's having some cyanosis, which is blue coloring around her mouth, and her fingers. This is just due to a lack of oxygen from the cystic fibrosis, which we can also work on breathing techniques that you can work on with her at home.
So, after doing a deeper dive into our patient, we were able to determine some impairments, activity limitations, as well as participation restrictions that we would probably see moving forward. So, some of the impairments include enlarged thoracic cage, increased respiratory rate, increased dyspnea, limited respiratory movement, clubbing of the digits, cyanosis, horizontal rib orientation, as well as kyphosis. Some activity limitations include walking, crawling, independent sitting, as well as social interactions. And then some participation restrictions would include playing with peers as well as social isolation.
Okay, so since we figured out where her delays are at, I just wanted to let you know, like, a typical developing child should be able to do all of those things, such as the sitting, crawling, and at 12 months she should be able to be walking and pulling herself up to standing, kind of like from kneeling, pulling herself up on a couch and stand up. So we are going to work on some interventions, kind of working on some of that, and as well as working on her sputum production, cough production. Is it all right if I work with Agnes?
Go ahead.
Okay, so the first thing I wanted to show you is basically an airway clearance technique. This position is called prone or semi-prone. So basically here we're going to have her laid over your leg, and then you can do some light taps.
Robert, come back. She's trying to teach us and educate us.
Fine, dear.
Sorry about that.
You're good. So, like I said, so prone over your leg, and we're just going to do some light taps, or you can do some oscillations, and this will help increase her cough production and her sputum production, which I want you to monitor at home and just let me know how much she's producing. The next thing we can do is we can also put her in called a 4-point position here to simulate that crawling, and just put some pressure down through her elbows, kind of simulating weight bearing, or down through her hips as well. The next thing we could do is called ball bouncing. This is kind of going to help with that unsupported sitting. So this might be something that we're going to do in therapy. I don't know if you guys have a ball at home, but basically here we're just going to have her sit, and we're going to hold onto her trunk, and we're just going to bounce around the ball. This is kind of simulating weight bearing through her hips and everything in that unsupported sitting position. And then the next thing we can do as the baby progresses and gets older, we can have her work on blowing some bubbles. Okay, now that she's a little bit older and she's gotten pretty good at this unsupported sitting position, we can work on getting some of that air that's trapped in her lungs due to the cystic fibrosis out. And a good way to do this is with bubbles. So I'd really recommend getting some bubbles for her home, because you can do this at home with her as well. So basically, we're just going to support her from behind and hold this out in front of her. Okay, Agnes, can you blow bubbles as hard as you can? Good, good, good. Keep blowing. Good job. And then, yeah, you can just do that as long as you can with her, as long as she's willing, and just keep blowing bubbles, just trying to get some of that extra air out.
Our physical therapist is already aware of what typical developmental age and limitations should look like in children. So let's dive deeper into what this should look like for children with cystic fibrosis. Cystic fibrosis typically display developmental struggles, such as difficulty sitting independently, which should normally be attained at 8 months. Delayed crawling and walking, or may need support to stand, should normally be attained by 10 to 12 months. Trouble grasping objects, normally attained by 6 to 8 months. Trouble manipulating objects, also normally attained at 6 to 8 months. And the expected level of function for a 12-month-old should include walking and pulling to stand on their own from half kneeling.
And the last intervention that I think would be good for you guys to work on at home with Agnes is just stretching out some of those chest muscles, just because with cystic fibrosis and coughing a lot, they can kind of tend to get rounded and tight. So here you could work on with something like a ball at home, and just having her put the ball up here, or a dangly toy that makes noise, and having her reach for it on both sides. This will help open up that chest area and get a good stretch right through these muscles. You can also work on like cycling her legs, just to get some movement through her legs, and work on some of that endurance, and or have her like kick the ball and work on some of that stretching through her hips and some. Well, thank you guys so much for coming to therapy today. I am looking forward to our next session, and please just let me know how those interventions go at home. You guys have a great day.
Thank you.
For this patient, we have determined 2 long-term and 2 short-term goals that we would like to work towards during our treatment sessions. The 2 short-term goals are as follows. Following PT intervention, the patient's guardians will be able to demonstrate proper prone drainage technique to increase patient's sputum production, measured by guardians, to be met within 2 weeks. Following PT intervention, the patient will be able to sit unsupported independently for 1 minute to be able to play with mom within 4 weeks. The 2 long-term goals are as follows. Following PT intervention, the patient will increase pulmonary function and activity tolerance to be able to play for a full 45-minute treatment session in order to reduce complications from cystic fibrosis to be met in 1 year. Following PT intervention, the patient will be able to blow bubbles for 10 seconds straight to increase forced expiratory volume and increase pulmonary function in order to reduce complications of cystic fibrosis to be met in 1 year.